Good evening, everyone. So, welcome to this second episode of चाय पे चर्चा with Dr. Rajat Jain. And आज की चर्चा करने के लिए today I have with me in the virtual studio Dr. Ankur Jain, a very close friend of mine. A very close friend of mine, Dr. Ankur Jain. Dr. Ankur is teaching, I think, in DBMCI. He is a teacher who is older than me, and a great experience of teaching a lot of subjects, and a psychiatrist by profession. And today we will be discussing about the importance of psychiatry as an MBBS student. So before I start talking about the branch psychiatry, for those who have attended my classes, I always say one point, and that is that there are two subjects in the MBBS that we people do not read. If we divide medical curriculum into 19 subjects, anatomy, physiology, biochemistry, etc., there are two subjects that we don't read at undergraduate level. One is radiology and the other is psychiatry. So, how important it is for a psychiatry during the MBBS, how much psychiatry an MBBS student should know, what is expected from the psychiatry in an entrance exam, how psychiatry is important in next exam, and what special things Dr. Ankur has done in eGurukul 2.0 as far as psychiatry is considered as a subject. Now, before I go forward, I just want some quick updates whether you are able to hear the voice clearly. So just give me a quick thumbs up to see whether the voice is fine. Okay, my chai is ready. Thank you. Yes, so just give me a sec, Dr. Ankur. Let me see whether the voice and everything is fine so that we can go forward.
Good evening, sir, and good evening, all. Very welcome to Chai Pe Charcha with Dr. Rajat Jain, a new initiative taken by Dr. Rajat. I think this is a very good initiative. As a psychiatrist, the best part of this initiative is that we are connecting people at this time when COVID pandemic is there. Yes, we are going more and more virtual, and the basic thing we used to say that remain connected to avoid all these psychiatric problems, to remain happy. And now we are saying that avoid these things, and this initiative definitely will fill the gap which has been generated by this pandemic. So as Dr. Rajat said that I am a very old faculty. You can say I'm teaching here for more than a decade. Uh, Now I have come with eGurukul 2. Yes, first of all, let me tell you what is the importance of psychiatry in our life. Not as a doctor. Yes, definitely psychiatry is important. But if you talk about a normal person, what is the importance in our life? You will find that our human behavior, that is psychiatry. And if we can modify it to get great success, yes, this is the motto. We should always keep in mind when you enter your MBBS, just like when I entered in second year, third year, you can say, now we say phase 2, phase 3, there was no department of psychiatry. This is the fact. And most of medical college, you will find there is no department. And we are posted in Agra for this. Sir, sir, आपकी voice clear नहीं है.
I mean, we can say that there are no separate departments in a lot of medical colleges. Like some colleges do have a psychiatry department, like in Maulana Azad with Associated GB Pant, we have a psychiatry department.
Yeah,
But what I will say is that even if you have a psychiatry department and the people have a posting, um, we used to consider them as a free periods
yes,
where we
definitely.
can have fun. Those who want to read their own subject, they can read their own subject. Some people they were interested, so they used to go for 1 day or 2 day, but not for the entire posting. So, what is
Definitely.
your experience when you were doing your post graduation in psychiatry? So, how was your experience with the undergraduate student who used to come to your department?
Yes, in our PGIMS, we were a little bit strict. In fact, we were allotted a particular batch. That's this batch will be taken by this resident, and we used to teach them, and it was little bit strict. Now the scenario has changed. If I talk about just like Dr. Earth said that in my own posting of psychiatry, I was sent to Agra, and for those days we enjoyed a lot. So at that time, nobody was concerned what is psychiatry, but it was considered as a free period, and this is the fact. Even now, yes, at many places we do consider psychiatry. 4 or 5 questions are asked. Even if we don't read psychiatry, then we can solve these questions. But the scenario has been changed. Now the new curriculum has been given, and according to that, previously there were 20 hours of teaching in UG. Now recently they have increased to 40 hours. There are 170.
Wow. Dr. Ankur,
Yes.
can you, the students who are watching this, can you give us an idea what has led to increase in the number of hours in psychiatry? I'm sure the people who are making the curriculum, there has to be a reason behind it, that why they have thought of increasing the number of hours for psychiatry. I mean, what is going on? Is it like they feel that an MBBS graduate should know more about psychiatry, or they have experienced something? Like what do you think is the reason of increasing the number of hours in the medical curriculum in psychiatry?
Definitely, sir, there is a solid reason. Dr. Rajat, and the people who are hearing, that if you see the recent data, 1 out of 4 person all over world is having psychiatric disorder in his own life. So this is a great burden which is going to, and recent study has shown that in India till 2025, 1/3 of budget is going to be spent on mental illness only. So this is increasing. The only reason that we are not acknowledging is that there is stigma.
India health care पर budget spend कर ले, वही बहुत बड़ी बात है.
Yes, the health budget, 1/3 of health budget, definitely is a fact. But it's unfortunate, you can say, that we are ignoring. But I will appreciate few celebrities who came with saying that I am depressed, just like Deepika Padukone came that I am feeling depressed. After that, that statement of that celebrity, many high-profile persons were coming to PGIMS saying that I am having depression. The only thing is
taboo associated with depression. So when I feel the group leaders, the celebrities, they speak about these things, that the taboo associated with the psychiatric illness takes a backseat. I feel that is the biggest reason. And the point that you have rightly mentioned is that the kind of the data that Dr. Ankur has told about, that these diseases are multiple, and I feel that one of the bigger reason is that we are seeing that the incidence of suicides are increasing a lot. Yep. And unfortunately, we have seen a lot of our medical colleagues have taken these extreme steps out of, the inherent issues, or the endogenous depression was one of the major lying factor. People keep on saying that it is related to the stress. Though do I understand that stress is one of the factor, but there are always people who are prone to undergo endogenous depression. So I think that the authorities must have identified that there is a big need for an MBBS student to identify these places at identify these things at a very early stage, because I feel that for everybody the first point of contact is an MBBS doctor. So we might not be the person who can treat those diseases in a same way as a psychiatrist do, but we should be able to identify those warning signs and should be able to refer the patient at a right amount of time before he's able to go to those extreme stages which are non-recoverable. So I think this is one of the big reason. Yes, Adnan, what you are saying is, I think Very correct. Yes, the taboo is not only among people but also among doctors. Yes, I completely agree with you
Yes,
with
sir.
the psychiatric diseases.
Yes, yes,
So,
sir. About
Dr.
that,
Ankur, what is your take on? So, I think that the government, the decision makers have taken a very good decision in increasing the number of hours for the psychiatry, and I think the same will gonna be reflected in the next exam or in the future exams that
yes,
are
sir, it
gonna.
has been reflected by INICET. This INICET, this INICET was having 11 questions from psychiatry. So not 3, 4, 5 questions. And most of these were clinical, basic things, means which a MBBS student must know. If they have attended their clinical posting, means they must know these things, and they will know because now the training is competence based. Yes, daily assessment would be there. Yes, I have gone through the complete curriculum, and I have planned my app in such a way that any persons in the second year which are posted in second year, or you can say phase 2 of MBBS, then there will be 2 week posting. In that there would be bedside teaching, there would be some demonstration, and many times you will find that we don't have ward. Yes, it's a basic infrastructure. We can't do anything because we are in developing phase. Definitely hope so that in future recently will become developed, but till then the idea which came in mind of Dr. Rajat and Dr. Nachiket to make a virtual medical college. Yes, I say eGurukul 2 is virtual medical college. Yes, if you have not done anything in your MBBS, or you are not able to get this opportunity to interact with patient, then we will provide. Just like what is the correct way of taking history. Yes, what is the correct way of taking mental status examination? Yes, in psychiatry. Yes, what is the taboo? Yes, when patient you enter the, yes, I remind one incident. When I entered my in my PG first day, there was an aggressive patient, and I entered the room of that patient, and he mentioned me or us in a abusive word. "Aa gaye," like that. Okay, then it was little bit weird that how we will handle, what will happen when he attacks on us. But later on I was told that the incidence of violence by psychiatric patient is less than the normal population. It is a research. This is the fact.
Yeah. Oh, I was not aware of this. Wow.
Yeah. So, and because we were afraid as a PG, it was our first exposure, so we were little bit apprehensive for further interview and all these things. Then our sir gave us, yes, first thing, we all, whenever we talk about in psychiatry, we do show research paper
I think,
that,
Dr. Ankur, you have raised a pretty valid point over here. See, these things should be made aware, and not just to the general public, but even to doctors, because as Adnan has rightly mentioned, that the knowledge of psychiatry leave about the general population. Even the doctors have very limited knowledge about the psychiatry, and that is why a lot of students are apprehensive about taking psychiatry as the preferred branch of their choice. Dr. Ankur picked it up by choice. I still remember he is one person who did double MD. Initially, he was teaching biochemistry, did MD biochemistry, and then after a lot of years, then he thought that no, he wants to do psychiatry, and he wrote the PG entrance exam again, and got a pretty decent rank and picked up psychiatry. So hats off to him. So
thank you,
Dr.
sir.
Ankur, so I think we know a pretty good reason that psychiatry should be taught very well to the undergraduate student. So even as an MBBS doctor, you should have a basic knowledge of the psychiatric illnesses. Now, coming on to what do you think, at what time ideally the psychiatry and MBBS student should start reading psychiatry? You mentioned second year MBBS. Okay.
Yes, sir.
So, to be honest, I totally forgot that whether we used to have a posting. Nowadays, we have started having early posting. So,
Yeah.
what is the ideal scenario? One, how effective you are as a teacher of psychiatry, how you will make the subject simplified. I mean, I feel that there is no formal exam. We are exam oriented people है ना, बिना एग्जाम के हम लोग काम नहीं करते. तो एमबीबीएस भाई पीजी एंट्रेंस एग्जाम समझ आता है कि साइकेट्री के क्वेश्चन आएंगे, है ना, बट वो बात है बाद की. एक एमबीबीएस स्टूडेंट क्यों पढ़े साइकेट्री? या तो मेरे को इंटरेस्ट आ रहा हो सब्जेक्ट पढ़ने में तो मैं पढ़ूं, बट इफ आई एम नॉट गेटिंग इंटरेस्ट इन रीडिंग साइकेट्री तो फिर मैं सोचूंगा चलो यार बाद में रट लूंगा किसी कुंजी से. तो हाउ यू विल मेक साइकेट्री इंटरेस्टिंग in eGurukul 2.0? Why? What magic will you do like you used to do in biochemistry 10 years earlier? So what I still remember, people used to consider us as brother because you are also Jain, I am also Jain.
Yes,
So
I
sir
do
आपके
remember.
भैया आए थे and he taught us biochemistry and he was extremely good. So
Yes.
उसी तरीके का magic आप psychiatry में now establish psychiatry faculty. So how you will do that magic in psychiatry?
So yeah, this is the valid point that when a MBBS student enters the MBBS, he is so much, exhausted by ana biochem, and these are little bit tough. And but in second year, he feels somewhat relaxed. It was called honeymoon proof. So, but in psychiatry, what I am doing? Yes, first thing in eGurukul 2, I will tell you what is the importance of psychiatry in life. I say, okay, forget about your exam. I am making you a better person. You must have heard many times in Indian literature, Indian Vedas, unconscious mind. Yes, we are regulated by our unconscious mind. Definitely is the fact. This unconscious mind is touched by Sigmund Freud and our Hindu Vedas. And now I will touch. Yes, I will tell you that how you can improve your memory. Yes, you will find that there are so many memory techniques in the market. Yes, acronyms. And many times you say that we usually forget the mnemonic itself. I would tell you, because you are not making the mnemonic properly. That's why you are forgetting. Sir, voice.
बोलते तो सब लोग हैं, कुछ दिखाओ तो बात करें कि
Okay,
पढ़ाओगे
sir.
कैसे. ये तो अगर
Okay.
कोई मुझसे भी पूछेगा मैं भी कहूंगा मैं बहुत अच्छा पढ़ाता हूँ. पढ़ा
ठीक
के
है सर,
देखो,
मैं
बात करें ना.
definitely sir. Let me share my screen. Okay, so now I'm going to discuss a very important child psychiatry topic on which questions are asked. Autism. In autism, if you are a layman, you don't know anything about autism, then I will say you will remember all the questions. Autism, I say autism is auto. Yes, you all know auto. Yes, how many tires in auto are there? There are 3 tires. There are 3 tires. So each criteria for autism, to diagnose a person having autism, the symptoms of autism should start before 3 years. Frequently asked question. And you all know auto are mainly run by males. Auto run by males. So autism is most commonly seen in males. Nothing to mug up. The only thing is that you remember autism as auto and all question will be solved. Yes, 3 years, 3 criteria. I don't mention 3 criteria. I am telling you for the time being that this is the mnemonic technique. What is the conceptual thing? Yes, conceptual thing. I never make mnemonic for conceptual thing. Only I make mnemonic only for those things which cannot be understood by any concept. So 3 years, less than 3 years is more common in male. Yes, 3 criterias are there. What are the 3 criterias? Let me show you. Yes, suppose there is a autistic child. Autistic child is lost in his own world. Yes, he is sitting. Suppose I am an autistic child doing like this. Stereotypic movement. What is stereotypic movement? Yes, this is spontaneous. Yes, I am doing it spontaneously. Repetitive, without any purpose. Stereotypic movement, first criteria. I am sitting alone, not talking to any person, means I am unable to speak. Language disturbance. Language disturbance. So first criteria I told you, yes, that is stereotypic motor behavior. Second, I told you I can't speak. I don't interact to anybody. No interaction, no social interaction. So how many criterias? three criterias. So you will remember, yes, I am adding concept with mnemonic. Yes, first important thing, I am adding concept with mnemonic. So autism, 3 tier, 3 years. Autos are mainly run by male. So male female ratio is 4:1. Three criteria I told you: stereotypic movement. Yes, no communication, mean language development is not there, social interaction is not there. Three criteria are there. Three male. Three criteria can be said as rules. Now I join them. Yes, I join them. 33% mental retardation. Yes, there is no logic. There is no logic in this. That how much percentage of autism will have mental retardation. So 33% have mental retardation. Okay. Now I extend it further. Yes, MMR. MMR. Yes, there was a relation of autism with MMR vaccine. Previously, there was a research. You will be surprised that a research was there in which it was said that due to this MMR vaccine, autism occur. And MMR vaccine was stopped. Later on, it was found that it had no relation with the autism. So question is asked that MMR vaccine is having no relation with autism. So these are, yes, in fact, all these are factual thing. You can make mnemonic by auto only. And there are 4 disorders on which questions are asked, and you will find in clinical practice also that these patients are having increased chance of autism. First is tuberous sclerosis. This is a auto. Auto is having how many tire? 3 tire. Suppose 1 tire is punctured. Now I am making picture mnemonic and story mnemonic. Yes, I told you that I will use multiple techniques of mnemonic so that you will never forget. And memory is nothing but habit. I say that you will be habitual. I will teach only 16 hours in my eGurukul for PG entrance. Other than that, I will include clinical thing also. So yes, in this, three tires are there. 1 tire is punctured. Punctured tire means tube is sclerosed. Yes, contraction means sclerosed. So tube is sclerosed, tuberous sclerosis. So autism is associated with tuberous sclerosis. When there is puncture, you will use jack, and jack looks like X. Jack looks like X. And you know, jack move like this, fragile X. This is a fragile X syndrome. So autism is associated with fragile X syndrome. Now he used jack, 1 tire is punctured. This is a person in COVID pandemic, always keep phenyl in his auto. Always keep phenyl in a auto. So phenylketonuria. And there is a bell in this auto. In place of phone, he usually keep bell in his auto. So whenever, yes, so congenital rubella. So autism is common in congenital rubella, tuberous sclerosis, fragile X syndrome, phenylketonuria. Frequently asked question. In fact, there is no, you can't make any logic. You have to mug up. Now, what is the importance of these picture mnemonic? Whenever you find congenital rubella, you will think of, yes, rubella, bell. There was a bell. Means you can also extend this mnemonic. It's not end here. Yes, autism, you can add anything on the auto. Yes, tuberous sclerosis, you can add anything on this tube. So this is the, yes, I'm not telling you on my behalf that I have made these mnemonic. There is a long research, yes, history that how we can improve our memory. And this is a part of psychiatry. So I have worked on that and I have implemented. Now you will find 10 questions from this diagram. Autism criteria, 3 criteria. Yes, 3 years. Males. Males means MMR, 33% mental retardation. MMR vaccine. Yes, congenital rubella, tuberous sclerosis, fragile X syndrome, phenylketonuria. And if you want to extend this mnemonic further, now ICD 11 and DSM 5, they have changed the criteria. They have, yes, I think.
Very nicely explained, Dr. Ankur. Am I audible?
Yeah, sir.
Yeah, very, very nicely explained. I'm very, very excited about the psychiatry in the eGurukul 2.0. And I'm very, very sure that the students who are watching this will also be very excited. Apart from just teaching psychiatry, about the theoretical part, a lot of students have asked me about, because everybody in a next is worried about the clinical scenarios, clinical simulation. So how you have handled those clinical simulations or clinical scenarios in your app?
Yes, sir. Let me share my screen once
Yes,
more.
yes, yes, please.
Yes, you must have heard about eating disorder. Yes, I will not take much time, but this is the flow diagram made by me. Yes, this is original diagram made by me. I would say, I can say, yes, that diagram, autism. Yes, I copied that many things, but in this, I have taken all these things myself, that you can solve all the clinical question by of eating disorder by this single diagram or single flow chart.
So I
Yes,
used to call them as memory maps.
sir,
Or
memory maps is little bit different. Yes, I will discuss, I will show you the what is memory map. Memory map is, yes, it is flow chart, because when I will describe at this time, I have taken the screenshot, or you can say jpg file. That's why I can't change the step by step. But when I use it step by step, then it becomes flow chart. And in memory map, we connect things logically. Yes, I have put, okay, let me tell you, in my app, I have changed my tone, I have changed my method many times. Okay, just to tell you that this thing can be remembered by another way. Yes, and this is the a new technique of memory. You can apply this. Okay, in not only in psychiatry, in any other subject. Okay, let me describe in simple way how to handle clinical scenarios. Yes, as sir said that students are apprehensive how we can handle a clinical scenario. You will find a long history of eating disorder when you will see clinical question. So many history. Just look at restriction of food or binge eating. One point. If restriction of food is there, only two diagnoses are possible: avoidant restrictive food intake disorder, anorexia nervosa. If patient says that I am not taking food because I don't like the smell of food, answer is avoidant restrictive food intake disorder. Yes, all the symptom: electrolyte imbalance, amenorrhea, means endocrine disorders, hypothyroidism, cortisol increase, all these things may be present in many eating disorder. But how to differentiate? If a person says that restriction of food is there, don't like smell of food, no need to go anything, answer it avoidant restrictive. But if says that there is body image disturbance, no need to discuss, no need to think any other thing, just answer is anorexia nervosa. Now a clinical question is asked. Yes, when clinical questions are asked, they give purging. Yes, binge eating episode, after binge eating episode there is purging. Purging means removal of food, just like vomiting. If vomiting patient is there, means purging is there, you find that the BMI is less than 17.5. The answer would be anorexia nervosa binge eating purging type. If BMI is more than 17.5, there is bulimia nervosa. So by simply looking at the BMI, you can solve the question. Yes, so this chart is not only for covering all the questions, but for clinical questions also. So I told you the one aspect by mnemonic. Second is conceptual. Yes, it takes 5 to 7 minutes to describe complete eating disorder. But yes, let me give you another clinical scenario. Okay, as yes, if you allow me, Dr. For 2 3 minutes more, then I will show you one more thing. Yes, how
Yes,
we
yes, please
can
go ahead,
handle.
go ahead, go ahead. Yes, please, Dr. Ankur, go ahead.
Okay, sir. Yes, this is a very, yes, as till now we said, okay, that was mnemonic, that was simplified, that flow chart anybody can make. Now I am integrating five topic of psychiatry at a particular point. Yes, five topic of psychiatry. Yes, let me start. Suppose a patient comes with low mood, sadness of mood. Yes, depressive symptoms are there. Depressive symptoms are present for 2 years, but they are not fulfilling the criteria of depression. You made diagnosis of dysthymia. Yes, I can, 1 minute, sir. I can show you the, yes, sir. How to handle, yes, clinical question. Yes, now it would be better understood by you. Suppose a patient comes to you with low mood, decreased appetite, decreased psychomotor activity, decreased sleep. You can't make diagnosis of depression because this is subsyndromic. Yes, definitely I accept it takes more time, but to concise it, yes, to make diagnosis of depression, there should be at least 5 symptoms. These are only 4 symptoms. These 4 symptoms are present for 2 years.
Dr. Ankur,
Then
आपकी
I,
स्क्रीन नहीं आ रही, are you sharing screen?
oh, let me check, sir. Yeah, I think now it's clear.
Yes, yes, now it is visible.
Okay. Yes, this is low mood, decreased appetite, decreased psychomotor activity, decreased sleep. Yes, you must have encountered all these symptoms. I don't say you are having depression, but suppose these symptoms are continuous for 2 years. For how much duration? 2 years. Then I would say you are having dysthymia. Yes, now after some time, after 2 years, you started having decreased interest. Means 5 symptoms are complete. Diagnosis of depression is there. Means on dysthymia, you added one more symptom of decreased interest. Now the diagnosis would become double depression. Yes, you will see the beauty of this flowchart. Yes, I will cover 15 topic, 15 diagnosis. Okay, let just give me a few minutes. Double depression. Now this patient came to you having these 5 symptoms. Yes, starting. Yes, he came after 14 days. You took proper history of 14 days. These symptoms are there. Yes, we have removed the dysthymic person. Now we take another patient. 14 days, you made the diagnosis of major depressive disorder. You treated the patient. Patient is not recovering. And you completed 2 years. You completed 2 years. Patient is not recovering. You will, yes, after 2 years, you will say it is chronic major depression. Yes, now I say what is the importance of past history? Yes, many times students are not concerned about the past history. This patient came to me having these symptoms. I said he is having depression. I did not take past history. Now I say I take past history. And in past history, I found one more episode of depression. One more episode of depression means more than one episode of depression. I say it is recurrent depressive disorder. Yes, I think this is recurrent depressive disorder. You took past history. You took past history properly. And you found that every time this depression occur in winter season, your diagnosis changed. Your diagnosis becomes seasonal affective disorder. So same patient, questions are asked, they will give these symptoms in all. Yes, they will give all these symptoms in all question. If these four symptoms, yes, if these four symptoms, 2 years, dysthymia. More than 2 years, yes, on dysthymia syndrome fulfilled, double depression. 14 days, major depressive disorder. Did not improve, chronic major depression. Proper history, past history of depression, recurrent depressive disorder. Yes, every time it occurs in winters, seasonal affective disorder. Now, you are a good doctor, you took proper history and you found that history of hypomania. I'm not describing hypomania, what is hypomania. I'm telling you the framework, hypomania. Then you will say that diagnosis is bipolar affective disorder, sorry, BPAD 2. If the history of mania, the diagnosis is BPAD 1. So same question, same language. Every time you will find so many questions. And if past history of manic symptoms is there, BPAD 1. Past history of hypomania is there, BPAD 2. Now you find this patient came to you having symptoms of psychotic illness. He is having delusion that my family member wants to kill me because I'm useless. My family member wants to kill me, I'm useless. Means he is having delusion. He is having delusion. Now you will make the diagnosis of psychotic depression. Psychotic depression. Same question, same features, points are changing and the answer is changing. Same question, patient came to you having depression, delusion is there, so you made psychotic depression, you took proper history and you found that in 12 months there is history of schizophrenia which was treated, but now only psychotic symptoms are there. Now the diagnosis will change to post schizophrenic depression. Okay, so all these clinical question you will find, they will change the language, that history. Yes, they will not say that is a mania, past history. They will say extremely happy. Yes, he is spending money. He is having increased sexual desire. Means manic symptoms of past history. Now, depression, BPAD1. Symptoms of hypomania, depression, past history, hypomania, BPAD2. Past history of schizophrenia, now having depression, and also psychotic symptoms are there, post-schizophrenic depression.
Wow, Dr. Dr. Ankur, you have made a very, very complicated topic very, very simple, and I think the question that was asked by Samrat has already been answered. That there are so many diseases having similar presentation. How will you differentiate them? So, beta, that is what Dr. Ankur has tried to simplify over here. That there are always some small catcher over there, as you see that just one catcher, delusion, then go for schizophrenia related. Now if it's a mania, then you're going to go to a different. If it's on hypomania, you're going to go to different. So just identifying that small point will help you in clinching to a diagnosis of this. So I'm very, very excited. I'm very, very sure that the psychiatry will be a big, big fun for all of you in the eGurukul 2.0. If you have any question, any more question, just put it onto the chat. Otherwise, we will stop for the day in this episode of Chai Pe Charcha with Dr. Rajat Jain, episode 2, What's New in the Psychiatry. And wait for the third episode that we'll be having soon, which will be one of my favorite episode where I'll be discussing with, I was waiting for since a lot on creating on having that particular episode with you. I will be discussing a lot of my MBBS life during that particular time with one of my special friend, Dr. Khushbu. and we'll be doing Chai Pe Charcha in dermatology. Just wait for that. I am specifically very, very excited with that particular session. We'll be announcing that today evening or maybe maximum by tomorrow, that when we'll be having that particular session. And I can assure you on behalf of the entire eGurukul team that the entire team is working very, very hard to make eGurukul 2.0 a one-stop solution for all your academic need, so that you can become a good doctor and you will be able to come out with great result in your future PG entrance exam, be it a NEET exam, be it next exam, or be it give any other name to that particular exam. We are there for all of you at all the time. We are launching eGurukul 2.0 on 24th of January. The event will be live streamed on our YouTube channel from in the exact. I'm just skipping the time. 11 to 12 is the time when we'll be starting. Do join us at the live event. There will be a lot of exciting stuff that we'll be doing apart from studies. If you are writing your exam, NEET 2021, then you can just quickly go through. But if your exam is delayed, then do join us, and I'm sure that it will be a great fun activity for all of you among this slightly depressing time of COVID which is going on, though there is a lot of hope that has come up with the COVID vaccine. One more message that I want to give to all of you is now we have two vaccines available, Covishield and Covaxin. A vaccine hesitancy is coming up in a big way. Please try to be role models. Please do not try to create wrong information in general population. Everybody consider us as role models. You do not have much information about these vaccines, so please do not try to create panic in people's mind that these are inferior vaccine in comparison to any other vaccine available in the world. They are pretty good vaccines. The indigenous vaccine Covaxin has got very good safety profile. Do not think that it is not being tested. Enough data is available showing the safety of this particular vaccine, and it's your personal choice whether you are getting it done or not. But please do not spread the news about the ineffectiveness of the vaccine or not. They are very good. I have seen a lot of my friends have got it done. I haven't yet got my chance, but the moment I will get it, I will get it done. My name was skipped in the list. I do not know how, but I have requested the medical superintendent that's put my name. So very soon I will be getting it done, and that is all. That is all for you in this episode 2 of eGurukul Chai Pe Charcha. Thank you, Dr. Ankur, for joining and give us such a detailed understanding of the psychiatry and how you're gonna make psychiatry so simplified and so fun learning. And I'm sure that the student will have a great fun in eGurukul 2.0 with psychiatry. Okay, thank you.
Dr.
Thank you
Rajat.
very much.